Welcome to Intimacy Evolution, the podcast that helps you enjoy deeper connection and more intimacy in your relationships. I'm Brianna Carey, relationship and intimacy coach, and together with my husband Mark, a licensed professional counselor, we're here to help couples create the relationships they crave. Relationships evolve over time, and that's okay. Let's talk about it. Today we have a special guest with us, Dionne, and she is going to be talking to us about something we haven't even touched on here yet, which I'm really excited. That's going to be menopause and also how to heal scar tissue in our body. And I will definitely let her explain that a lot more. So welcome, Dionne, to the show.
Hi, Brianna. Thank you so much for having me. I hope I pronounced your name correctly.
Yes, you did.
Good. Thank you for having me.
Thank you for being on here. So please tell our listeners how you got into your journey, because I know you've been a holistic practitioner for 27 years and you kind of got into what you're doing now through your own experience of having a hysterectomy. So can you take us on your journey and how you got started and how you transitioned to where you are today?
Yes, Brianna, you're right there. My journey started from my own personal story of having a radical hysterectomy in 2015. And before then, I was treating both men and women as a wellness professional for 27 years. And through that journey, through that operation, I started to specialize in sleep for both genders because I was no longer as athletic as being able to jump through my legs like you do in Ashtanga yoga. So, from that to becoming bedridden, I started to specialize in sleep. And also after surgery, I wasn't able to sleep. It's like, because both ovaries were removed,
right?
You know, estrogen helps us sleep. So because that was removed 2 weeks after having open surgery, I wasn't able to sleep like many, many other women in my position.
Yes.
So that's why I started to treat both genders with sleep. And then as I started continually being more fascinated about the female form, reference to our womb and what that's like when it's removed, or parts of it is removed, that is when I retrained as a women's coach, specifically menopause, and then started to treat women specifically in reference to scar tissue around their surgery.
We can really dive into a lot of different parts there. One, can you share with our listeners, a radical hysterectomy? What does that mean, entail? What goes into that?
Yes, I'm going to explain it in very simple words because my pronunciation of Latin words is not good at all. I was born with a lisp and a stutter. So although my hands do the walking and I am very natural in finding anything anatomically wise in reference to saying their names, I fall down flat.
Okay. No worries.
Radical means that everything was removed. That equates to 6.5 organs being removed.
Wow.
And I say organs because each part of a woman's womb is classified as one organ. You can actually have surgery and have one of them removed.
Yes.
So the word hysterectomy is just used so broadly, and it's an insult to, all the women under the knife and what they've had removed and what they haven't had removed. So radical means everything. It means that you've kept your ovaries, which means that you might not start your menopause, even though you've had a hysterectomy. And then the others are all partial hysterectomies.
Okay. So you had cervix, uterus, fallopian tubes, ovaries.
Yeah.
All removed, which does put you into menopause since you don't have the ovaries. And so that, and like you said, the estrogen helps with your sleep. So that's where you came in with that. But what did you start noticing as you started healing from your hysterectomy about, now that space where your womb was, your womb space, your healing? What was that like?
Yeah, so it's the journey with scar tissue, basically. So it's like you take a couple of steps forward and due to the patriarchal society that we live in, we approach our healing very much like a competition, very much like a badge of honor.
Yep. How quickly can you get through it?
Yeah. And you go on Facebook and you're like, look what I'm doing week 4.
Yeah.
And post like that.
Yeah.
And it gives such a disservice to women who are not having that type of recovery. And also that's why I made that statement about the word hysterectomy being just like an umbrella term that does disservice.
Yeah.
Because if a woman has had one organ removed and it was laparoscopically through keyhole, then of course you might be riding a bicycle after 4 weeks.
Right.
But a woman's had 6.5 organs, so 4 organs, and it was open surgery, that's not going to be the case.
Right.
So when one starts to hold their healing journey to those sort of standards, that makes their mind competitive, and they start to push through what their body's actually telling them, what their body's feeling.
Yes. And
they just go into the leaflet said, or the post said, or everybody in this Facebook group is doing.
My friend, or
6 weeks, 8 weeks, 12 weeks, done after 12 weeks.
Yes.
Then when they start taking steps back, having, pushed themselves hardcore to be there at 12 weeks, those steps back is basically a warning and information due to that heavy load and that attitude and how they've dealt with things. That scar tissue has formed, and scar tissue is now solidly, that was first liquefied because it's a gel. It starts off as being a gel and then it hardens over time.
Okay.
And now it's there full start, present and hard. And that's the pulling sensation that a woman feels in her lower abdomen, around her root, where her womb was, where her uterus was, where her beginning of her new cervix is, or where groin and hips is, where her ovaries used to be, and all that pulling that one feels upon movement, upon even breathing, upon even being full with food.
Wow.
Sitting, walking, lifting, carrying something, even carrying their newborn baby, which is possibly, even if the baby is premature and the baby is only a few months old, that is 4 pounds. That feels like 16 pounds.
A lot. Yeah.
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 So that pulling is one thing. The shooting, stabbing pains, that feels like electric. So like lightning, sharp pains. These are all signs that scar tissue is present.
Wow. So after you had your surgery, was any of this explained to you?
No.
Was there like no, and there was no like regimen for helping you to get, your 6 weeks of heal time? There was no regimen of like go to a physical therapist or anything like that.
And that was 2015. And still today, that's not there for women.
Yeah. I see a lot of similarities. I mean, I know I'm not shocked about it, because that's not recommended for women that have babies. After they have a baby, we should be recommending pelvic floor therapy. Also after having C-sections, because again, you were cut open and everything was taken out and then placed back in. And then you have this, stitched up, and it's just a disservice to women all around. And even the ones that you were talking about, like laparoscopy, I had one of those in 2007. And I had 3 small incisions. And I mean, just because I can walk out of there and, everything's fine. But like you said, there's little balls of scar tissue that are there. And who knows how that's impacting me in ways that I never realized before.
And we have fascia all around there, 360 degrees around. And so those little balls of like granulated tissue that's embedded around the scar tissue, and the scar tissue is embedded around them. that's having a knock-on effect around your fascia.
Mm. And then what is that going to impact?
When it wraps around the whole of your pelvic, bowl.
Yeah.
So that's your hips, that's your groin, that's your lower back, that's your sacrum, that's your coccyx, that's your pelvic floor.
Okay. Let's keep going because I'm just like, we need to do better for women. This is, yeah. So thank you. One, I'm just going to probably thank you a lot for speaking on this and sharing this, because this is what we need to be helping women with. Understanding they don't have to suffer through this pain that they're experiencing. And there's an explanation for the pain.
Yeah.
Not just them. It's not. Yeah. So how did you start navigating this? Let's branch into the scar tissue journey. You noticed the scar tissue after your surgery. What are some things that you started doing? And then how are you helping other women with this?
I didn't notice that when I didn't know that what I was experiencing was scar tissue to begin with. I just kept noticing it was a couple of steps forward and a couple of steps back.
Mm-hmm.
And so I started my HRT journey. And then I started to look for answers why it was steps forward and steps back. Mm. So I kept complaining to the medical profession and asking for help.
Yeah.
And then eventually that led me into, I need to help myself more because I'm not going to get total help from you.
Yeah.
And so, for example, that led me into, I'm going to train in women's health and become a menopause coach. But let me give you an example. I was on the phone to my doctor and I was asking for testosterone.
Mm.
And for those of you who don't know, women have testosterone, and just how men also have estrogen. Mm-hmm. It's just that we have lesser doses. So estrogen is seen as the female hormone and testosterone is seen as the male. Mm-hmm. So when I was asking for testosterone from my GP, from my doctor, she was telling me how it's, it's not licensed in the UK for women to be prescribed it. And there's no medical evidence that it's going to be of benefit and da-da-da-da-da-da-da.
Oh.
So I'd already started doing my training before I asked for this. So at that point, I had to tell her that I was training as a menopause coach.
Mm-hmm.
And therefore, I know what my rights are. I know what I'm asking for.
Yeah.
I know that it does work. I know that I'm entitled to it. I also know where testosterone comes from. Mm-hmm. And therefore, it's from the ovaries, by the way. And therefore, having both ovaries removed, there is absolutely no way that my health can even come up to being normal, mm-hmm. because I have no reserves of it whatsoever. And as a human being is meant to have testosterone in their body, and all of mine is removed, how can you expect me to work or live without it?
Right.
So then she said, okay, I'll make you an appointment at the hospital. So then I was out having lunch with a girlfriend when the hospital called me and had to remove myself, take that call into the bathroom and tell her exactly the same thing because I was getting exactly the same answer.
Yeah.
So once I told her the same thing, and also in some states, also in America as well as the UK, they think testosterone for a woman should only be prescribed if she is lacking sexual drive. And they don't understand that testosterone is actually the motivator for a woman to get up and do anything.
Yeah.
So when a woman is being prescribed, for example, antidepressants, mm-hmm. this is where testosterone could even help because it's the motivator. It gives you energy. It affects your mood, your positivity. It allows your muscles to be able to activate themselves and contract so that you can get up and do the things you need to do. So it does the mood of activation and motivation, as well as the physical activation in the body so that the body can actually get on with activity. It's not just about sex. So that is how I was managed to get my testosterone, was telling a gynae surgeon that information. And it's like through arming myself with such information is the only way to get help. So that is what led me into then every step of my way of me healing myself made me had to train on the same par of somebody in the medical profession, then advocate for myself to get the help that I need. And where they can't help me, such as, so what do you do with scar tissue? That is when, okay, there's nothing that they can give me to help me with scar tissue. So I've got to now train in scar mobilization to help myself with scar tissue. And then that just basically fueled my mission to then go, look, if I have to do this, how many women don't know how to do this? Because they don't have 27 years as an holistic practitioner to go ahead and do it. So that's what motivated me to then go, okay, now I know it.
Yeah.
And now I've got to share it.
Yeah. And I don't understand why this is a thing, because my husband had knee surgery a couple of years ago and he went to physical therapy, and they talk about the scar tissue and to break it up because they need to keep the mobility in the knee. And why do we not think that that is going to impact a woman when she is being cut open from whatever she's having, a hysterectomy or a C-section or a laparoscopy? Like, how is that not clicking? You know what I mean? So I'm just like, of course we need to.
Yeah.
So
the physiotherapy world knows about it, and the therapists would help.
But the medical, like, you know, the practitioners that are the surgeons are not then referring out.
Yeah.
To continue supporting their patient.
And it's 57% of surgical complications in the US. This I don't even have European speakers yet. In the US is down to scar tissue. So patients have to go back and have surgery of some sort due to the damage that scar tissue has caused from their first surgery. When you look at operational complications, what are those complications? Those complications are around scar tissue. And 93% of women in the US, if they've had abdominal surgery of whatever, whether it's a C-section due to pregnancy, whether it was a C-section due to a hysterectomy, 93% of them have problems with scar tissue afterwards. And we pull it down to something else.
Wow.
Gut problems, bladder problems, painful sex, stitches after having a baby. We put it down to other things because we don't know the damage that scar tissue is doing to the body.
Wow. So a woman that is noticing she's having these sharp pains, or like you said, kind of the like electric shocking, feelings. What are some things that she can start doing? I mean, besides going to a physical therapist to help with that, is there anything that she can start implementing at home to kind of narrow that down, or to start taking matters into her own hands?
Well, you still need instructional help, whether you're going down the route of yoni work and doing pelvic floor yoni work, whether that's yoni work with a crystal, whether that's yoni work with a Kegel, whether you're doing specific yoni work for your pelvic floor is one route. Whether you have diastasis, which is a gap down the midline of your abdomen down into your pubis, which is so like your muscles have separated. That's what diastasis is. Whether that's happened after you've had your baby, or whether that's happened due to open surgery of a hysterectomy. Then, working with a physiotherapist to close the diastasis is another thing. And then there's the work that I do, which is scar mobilization, and actually breaking down the adhesions and then going on to do those two pieces of work afterwards. But YouTube is a great source. Do you know what I mean? You can type any of these words that I'm saying and go, okay, yoni work. How do you spell that? Y-O-N-I. Okay. Watch a few videos, find somebody you resonate with, you connect with, and go, yes, I'm going to go down that route. Find a physiotherapy therapist that specifically deal with abdominal adhesions or pelvic floor work, and then contact them.
Yeah.
or watch their videos and apply what you can from their videos before you can actually reach out and contact them. So this is how to take it into your own hands. Yes.
So good. So how do you work with women now in this space?
So I have a 6-week program whereby I help women apply the actual technique to themselves in the comfort of their own home. So they are learning
Tell me more. Yeah, tell me more.
So they're learning how to soften and erase the scar tissue from their upper belly all the way down into their pelvic floors. Because they are dissolvable.
Yeah.
And without dissolving them yourselves, there is a new operation that is available. It's called lysis. Sorry if I'm not pronouncing it correctly. It's Lysis. And they actually go in through laparoscopic surgery, remove the adhesions, and close you back up again.
Right.
Whereby the laparoscopic
You now have new
causes adhesions. And then also, you might be back in 10 years' time. They say basically on average, it's successful for 10 years. So are you going to have that surgery every 10 years?
Right.
Or you can join me on a 6-week program, have access to the vault for a whole year, be among a community of other women holding your hand through it as you're doing it, as they're doing it, as you're healing together. I know which way I would prefer.
Right.
And that's why I trained in it.
Oh my gosh. I love that. And I know we'll be linking everything in the show notes. Would you like to share more about your program? Or I know you have another offer for our listeners as well.
Well, how I designed the program, there's 2 special ways about it. So yeah, in a nutshell, we're taking away the scar tissue, but I call it Heal Abdominal Wounds and Scars, because every scar has a story. That's the wound aspect of this work.
Yeah.
And so whether that is the overshadowingness of the pain of the trauma of giving birth, and that's been overshadowed by the joy of having a baby. And maybe, a woman had felt the joy straight away, but haven't been able to fully embrace life as a mother afterwards because of how much pain she's in. That's one story. Another story is the actual loss of a womb, whether it's full, whether it's partial, but it's a loss. It's a great, huge, gaping loss. And women grieve it like grieving a physical person, a loved one.
Yeah, that was part of you.
And it affects one's whole identity as well. So you're grieving a part of yourself that has died, that has been removed.
Yeah.
And sometimes it's not the womb. Sometimes it's, there's a woman in my program at the moment. She had a hysterectomy. She was dancing afterwards. And then a year later, she had the hysterectomy. Even though she was dancing afterwards, it caused a hernia. And the hernia was more traumatic than the hysterectomy. But they are related. And it's still the abdomen. It's still the most subtlest, sensitive, intimate part of ourselves. And so I deal with, abdominal wounds and scars. And so that could be the story. Whether it's the appendix or a hernia or liver or gallstone, it's still the abdomen. It's still a woman's belly. Just the thought of a hand on your belly just makes us feel emotionally how sensitive it is.
It is. And I've heard that some massage therapists don't like to do abdominal massages during a massage because it is an actual intimate area. I think that's interesting too, but it makes sense as you're saying it.
So in the program, we work through the story behind the scar, and that is taken care of, and then space is given to that, and voice is given to that, and acknowledgement is given to that in a sisterhood circle of other women. And then the second session, we work hands-on implementing the scar tissue work. So both is dealt with in my program together, synonymously.
Oh, I love that.
One, as we go through whichever aspect we're working with the wound, we then apply that same aspect to the hands-on scar.
And
I also do it. There's a third element which I love, is that I do it in a format, in a modality that's called circle work. Circles, have you heard of them?
Oh, yes. Yeah.
So that's the modality in which I teach this in.
Oh, I love that.
So it's all set in the container of a women's circle, which is the opposite to the patriarchal way of linear lines that the world operates in nowadays, whereby we have the head of the boardroom and the owners of the company, and then you have the shareholders down at the side. And if they don't agree with the head, then they can get bought out, and the door is at the other end of the table. If you don't like what I say, then there's the door, you can leave.
Right.
Well, circle concept is everybody's equal. Whatever background, whatever race, whatever class, every woman is equal.
Yeah.
Every woman's voice is respected. A woman gets seen, heard, and given the space to just be herself and held in light as she goes through the journey. And that's the modality in which the program is delivered in.
Yeah. We need so much more of that. That is, I mean, if you think about like our ancestors didn't navigate this stuff on their own. They had support, they had sisterhood. I mean, we are in the feminine awakening right now. And I just think this is so powerful that you are speaking on this. And I love that, you know, it applies to where I am at with clients and their pregnancy and postpartum phase. And then you're supporting women as they're navigating this other aspect of their womb. And I feel like that is in a way a full circle too, where we're connecting that circle of life almost with the womb.
Yeah. And I join it in the middle as well for women who haven't had the opportunity to have a baby and they're trying one last time.
Yeah.
Between the ages of 35 and 45. Due to the environment of their womb, they haven't been able to conceive. And that same environment, that hostile environment, is adhesions. And by working with that and cleaning that up, you're making your body a better host for a baby to be able to be conceived. So it is very important for a woman who wants to have that last go of focusing on her health so that she can conceive. This program is perfect for her as well.
Oh my gosh, I love that so much. And this is definitely needs to be shared like everywhere. Every woman needs to hear this and understand, because again, so many different things that happen throughout our life, like you said, gallbladder or appendix or hysterectomy or a baby, like there are a plethora of ways that this can be impacting her womb that she never even thought about. It could be the scar tissue from that surgery.
Yeah.
And you get to help them with that. That's very special.
Thank you. I think so. I feel so.
Yeah. I have another question. I want to loop back real quick. Did they not suggest estrogen, or did they not put you on estrogen after you had your hysterectomy, or did they do that, just not the testosterone?
Yes, they did do that.
They did estrogen.
I asked for it. They didn't just there's no, menopause is not even mentioned. It's like, let's just whip your womb out.
Yeah.
Please just sign your consent and let's just get going.
Even though we know the ovaries produce these hormones that we need to function.
Not mentioned.
No mention of that.
No, I had to ask about menopause. And then I was given the drug that's even, it was taken off the one that was made by horse's urine. I was given that in tablet form to leave the hospital with.
Okay.
It's even the worst one that we don't even prescribe anymore.
Right. Wow. That is a lot to unpack. Wow. This was very insightful. I have a lot of information, and I cannot wait to just send everybody your way and share your information and your knowledge and your wisdom with everybody, because it is so important. Is there anything else that is on your heart that you would like to share or that's coming through for you?
Yeah, the work that I do with sleep, like I said, I wasn't able to sleep after my surgery like so many other women. And if you're not ready to do the scar tissue work, or it doesn't apply, and you want to know what's next after that, Dionne, what else are you doing? What are you doing? What else are you doing? Then you can just stay in my ecosystem, and you can do that by visiting www.3secretsaboutmenopause.com, and that's where you can find my freebie. And it's a mini 3-part video series again on the things that aren't mentioned by doctors when it comes to your menopause. So that's what it is. And if you're ready for the program to clear your scar tissue, post or pre-baby, then it's www.HAWS, which stands for Heal Abdominal Wounds and Scars program.com.
Oh, I love that. Yes. And I will have everything linked down in our show notes as well. Thank you so, so much, Dionne. This was a wonderful conversation, and I am so glad that you came on. So
thank you,
everybody, and we'll see you next week.